Alright guys, let's discuss about the neural tube defects. So one of the common neural tube defect is basically the spina bifida occulta. So spina bifida occulta is very common neural tube defect, but this is not very severe neural tube defect. As we know that neural tube, the covering of the nervous system is basically the meninges, the three layers of the meninges like dura mater, arachnoid matter and then pia mater. So actually the spina bifida occulta is basically the type of the defect when there is failure of bony canal to fuse. Here you can see. So, but there is no displacement or the protrusion or the herniation of anything relating to the neural tube. So this is just like a bony defect, and there is growth of the tough hair on the skin. So you might witness such patients in the future that if there is no herniation or the displacement of the structures of the neural tube or the nervous tissue or the meninges through this bony defect, and these bony defects might be common due to the deficiency of the folic acid, or if mother is using any other teratogenic drugs. So you should understand that actually this is most common spina neural tube defect, the spina bifida occulta, but this is not so severe because there is no displacement or the herniation or the protrusion of structures relating to the neural tube or relating to the nervous system. But in next structure you see the meningocele. So meningocele mean that there is displacement of the meninges. As you can see here, that meninges is the covering of the basically the nervous system or the neural tube. So there is displacement of the meninges alongside through this bony defect. So this is called as meningocele, but still there is no displacement of the nervous system structures. So meningocele is simply the displacement, the protrusion or the herniation of the meninges through this bony defect. So this is called as meningocele. And in next you see the most severe form, and this is called as myelomeningocele, and in this defect there is basically displacement of both meninges and the spinal cord through this bony defect, and this is called as myelomeningocele. This is the most severe anomaly because there is no protrusion, there is displacement of meninges also alongside the nervous system structures also. So this is the basic difference in spina bifida occulta. This is a normal structure. Here you can see the normal structure, and this is simply the bony defect. Here you can see the bony defect, and in this structure you can see the displacement of the meninges through this defect, and in last structure displacement of the nervous system also. So that is the most severe form, that is called as myelomeningocele. I hope you understood. Thank you for your concentration.